Good afternoon, Dr. Todorova. My name is Bryan Haas. I'm here with Taylor. I've already briefed Taylor on this examination. Of course, we need to get consent. We need to get verbal consent. Taylor, do you give us consent to go ahead and videotape this abdominal exam?
Yes.
Okay, great. I've already washed my hands. We have Taylor in a supine position here, pillow underneath her knees there. Takes the pressure off the abdomen. So let's start with the exam. The first part of the exam is inspection. We want to look at and inspect the overall contour of Taylor's abdomen. We want to see if it's scaphoid or sunken in, if it's flat. Hers is flat, nice flat abdomen there. If it's rounded or protuberant, we want to make note of that as well. We're looking at the overall structure. We're looking to see if there's any masses, any lesions, any hernias. If we note any hernias, any previous or post-surgical scars, we definitely want to note. And we also, of course, want to see and look in the abdominal aortic area to see if there's any pulsations indicating a possible aortic aneurysm in the abdomen. We also want to see, general peristalsis. Do we see movement? You want to make note of that as well. And then finally, we want to note the color of her skin. She has a nice pink color to her skin. If the liver's jaundice, there'll be a jaundice color or a yellowing of the skin. We definitely want to make note of that. The next part of the exam is auscultation. So we want to auscultate all four quadrants of the abdomen. We're going to start with the diaphragm in the right lower quadrant there and listen to bowel sounds in the right lower quadrant. We're going to go to the right upper quadrant. And with bowel sounds, we should hear and listen. We should hear sounds that are about 5 to 30 sounds per minute, left upper quadrant, and then left lower quadrant. If we don't hear bowel sounds for up to a minute, we want to listen for all the way up to 5 minutes. And we're noting those sounds. Are they normal? Are they hypoactive? Are they hyperactive? We definitely want to make note of that. Next part of the exam is we want to auscultate all of the arteries, uncross your legs, all the arteries in the abdomen. So we want to first start with the aortic artery, and this time instead of the diaphragm, we want to use the bell to listen for bruits. And a bruit is like a blowing or swishing sound that we will hear. So here's the abdominal aorta below the xiphoid, above the umbilicus there. The next arteries we want to listen for are the renal arteries off to the side, a little bit lower than that on both sides. Right renal artery, left renal artery. After those arteries are the iliac arteries, which sit just below the umbilicus, lateral to that about 2 inches or so. These are the iliac arteries here, listening for bruits as well. And on the left side, finally, we'll listen to the femoral arteries, which can be found by bisecting the ASAS and the pubic symphysis under the inguinal ligament there. We want to listen for bruits in the right femoral artery and the left femoral artery there. And good, nothing there. The next part of the exam is percussion. We want to percuss the 4 quadrants. We're using our non-dominant hand, gently place it on the abdomen. We're using our dominant finger to strike the middle finger, the last digit of our middle finger. We're trying to listen for a tympanic or dullness in all 4 quadrants. And we're starting in the right lower, moving into the right upper. We come across here. You can still hear tympany. If you happen to hear some dullness, that could be means of fecal impaction. Sometimes patients, there's tympany right there. And we come down into here, tympany there. And then we want to auscultate in the bladder. If the bladder is empty, that should be a tympanic sound as well. In her case, it's empty, it's a tympanic sound. If you hear dullness, that could mean a full bladder and/or there could be a mass or some type of cancer or something or growth in the bladder there. That's not normal if they've already urinated, if they have already emptied their bladder there. The next part of the exam, we want to percuss the margins of the liver. We're going to do the right midclavicular line. We're going to start on the right side. We're going to hear tympany coming all the way up here And then once we hear dullness there's dullness right there. We want to mark that and make a note there with a pen or a marker there. That's the lower margin of the liver on that side. Then we want to come up higher here, midclavicular line, intercostal space, and we want to tap until we hit dullness. Again, right now it's tympani, and as soon as we hit dullness, that is the upper portion of the liver, the margin of the liver on that side. Mark that, we measure that. Normal is between 6 and 12 centimeters, so we definitely want to make note of that. The other part of the exam here in percussion is we want to percuss in the spleen there. When we percuss the spleen, it sits around the 10th intercostal space. Axillary line here, this mid-axillary line here, same thing there. We're going to tap, ask the patient to take a deep breath. As we tap, we should hear tympani even when the patient takes a deep breath. If there's dullness as the patient takes a deep breath, that could indicate the spleen is enlarged. We definitely want to make note of that. Okay, the next part of the exam is we're going to palpate. So we're going to palpate the abdomen gently using light palpation. The pressure is basically at the palms or tips of our fingers on both hands there. Kind of a circular motion, about 2 centimeters in depth there. We want to palpate in each quadrant. We're trying to palpate to see if there's any masses, any lumps, anything abnormal, any hernias there. We ask the patient, does that cause any pain or tenderness?
No.
Okay, good. So no pain or tenderness in her abdomen. We come through all 4 quadrants there in palpation. And then we want to go into a deeper palpation. The deeper palpation is about 4 to 5 centimeters in depth. Same thing, we're just putting a little bit more firm pressure in all 4 quadrants there. Again, asking the patient, does that cause any pain or discomfort or tenderness?
No.
Good. And again, noting any masses, any abnormal hernias, lumps, anything, any rigidity. Sometimes there's rigidity. We might have to note that as well. As we palpate that, we want to palpate underneath the liver, and we also want to palpate the spleen. So to palpate the liver, we go to the last rib there, underneath that costal margin there. We have to kind of go underneath the rib, and as we go underneath, we're going to have the patient take a deep breath. Most of the time, we're not going to feel that margin of the liver as we palpate. In some cases, we may. The same thing with the spleen. We're going to ask the patient to come on right here. We're going to palpate the spleen, take a deep breath. We're normally not going to feel the spleen as well. After that, we want to get into some specialty tests. One of the tests is Murphy's sign. Murphy's sign is a sign to indicate a possible enlarged gallbladder, cholecystitis. What we do is we come left clavicular line, midclavicular line here. Right midclavicular line underneath the costal margin there. As we come up underneath, we ask the patient to take a deep breath. And as they take a deep breath, if that elicits pain or they're unable to do full inspiration because of pain, if it elicits pain, that could indicate the gallbladder is enlarged. And even the liver for that matter. There could be cirrhosis of the liver or fatty liver in that case. The next specialty test we want to do is we want to see if there's any wave stiffness or looking for ascites. So this exam is relatively easy. We have the patient bisect their abdomen and the umbilicus there. I'm taking my left hand and position it on her right flank, and my right hand is on her left flank, and I'm pushing into the abdomen there to see if there's any fluid shift that I could feel on this opposite hand. If so, that could indicate some fluid in the abdomen and some ascites going on. We definitely want to note that as well. The next test is looking at appendicitis to see if the appendix is swollen. This is the iliopsoas test. We have the patient flex their leg. I'm going to apply resistance. You hold against my resistance. Good. That cause you any pain?
No.
If that caused pain, that can indicate appendicitis. The appendix is swollen or enlarged there. So we make note of that. The last one is we have her sit all the way up there. We're looking at assessing the costovertebral angle, assessing the left and right kidney. So we find the 12th rib On the left side, we find and palpate the spine, and that creates an angle. We place the one hand underneath that angle there and simply tap with our fist there and see if that elicits any pain or tenderness. Does that cause anything?
No.
If so, we definitely want to mark that. That could indicate that there's an infection, UTI infection, pyelonephritis, kidney infection in that area. Then we come off to the right side, underneath the right lower rib, find the spine, and then we tap or pound that area there. Any pain or discomfort there?
No.
Great. Thank you so much, Taylor. That concludes the examination of the abdomen. Thank you.